you to take the opportunity to introduce yourself and just jump right into what you're going to be presenting on, because I think it's such good information and it really gives kind of a whole picture of what's going on in regards to extreme.
Great, thank you. Trying to set things up so I have things on the right screen. It looks like I need to send a request to share, so I just did. Okay.
Go ahead and try again.
Okay. And I want to share this screen. Always try to arrange things so it's not like totally crazy. Are you seeing my slides? Yes, perfect. Okay, now let's do the interview. All right, how's that look now?
That's perfect.
It's hard to see what's happening in the chat. So if there are any questions or things come up or technical difficulties, if someone just comes off mute and tells me, that would be a lot better for me. So, all right, well, thank you. So we'll just go right in. As I said, I'm Chelsea Langer. I work with the Environmental Public Health Tracking Program, which is a CDC-funded network of 33 jurisdictions around the country. Our main product is this public-facing portal that we host. So it has a variety of content pages. So here's the heat-related illness one that goes through, you know, what is it, how to recognize it, how to protect yourself. We also have indicator reports where those look at trends over time and puts in more context. So for heat, it goes through, you know, like heat-related emergency department visits. Why is this important? Why we care? Damn it, it's on the timing thing. Okay. Anyway, we can do this. So indicator reports go through more like trends over time with the background information and the context. And then the real powerhouse of the tracking portal is the data portal, or the queries, where you can go in and actually modify the data to your specifications. So you can look at just Bernalillo County, you can look at trends over time, you can look at by age, by sex, you know, you can really tailor it to your specification. And that, again, is like our main kind of product as the tracking program, is this portal with all of the data and information available. So I assume most people here are familiar with what heat illness looks like, but just in case. So the first symptom is that you are thirsty. And this is not always linear. It can progress very, very quickly from feeling fine to heat stroke. But so heat exhaustion can encompass nausea, vomiting, rapid heart rate, sweaty skin, headache, weak, dizzy, cramps, generally just not feeling well. Heat stroke can, you know, high body temperature of over 103 degrees. At that point, there can be little or no sweating, red hot, dry skin, again, rapid heart rate, convulsions, seizures, confusion, disorientation, fainting. It can lead to coma and eventually death. So some environmental as well as personal risk factors. Environmental, the most obvious is having a hot temperature if it is hot outside, or if we are in a heat wave. There are also things within the man-made environment, such as limited access to transportation, limited access to medical care, lack of cooling centers, the urban heat island effect. Fortunately, I don't need to explain what that is. Personal risk factors are, you know, age for the young or the elderly. If someone is overweight, if they have existing medical conditions, like diabetes, heart disease, a long list of very common existing medical conditions. If someone is socially isolated, if someone uses alcohol or other substances. And then there is a long list of fairly common medications that can impair a body's ability to regulate temperature or inhibit perspiration, both of which would be a risk factor for heat illness. Okay, so the point of this slide is to show that heat illness starts at temperatures that are not really anywhere close to extreme, especially what we would consider in New Mexico. So the graph on the left shows heat-related emergency department visits in 2023 in the Albuquerque metro area. So the purple line on the bottom are weekly emergency department visits. The orange line is the maximum temperature in the metro region. And then the green straight line is at 80 degrees. And then the red straight line is 90 degrees. So you can see, can I use my mouse? Yes, okay. So you can see at 80 degrees, we start seeing people coming in. It's usually when we start seeing it. And then here, once it's like pretty consistently 90 degrees is when we have the really sharp peak up. This also falls in line with the occupational heat standards that are currently proposed in New Mexico and have been adopted by a few states around the country, where the heat standards for workers start at 80 degrees, and then the high heat provisions kick in at 90 degrees. The next 3 slides, we're going to go through emergency department visits, then hospitalizations, then deaths, all for 2010 to 2022. The graph and the map all come from the portal. And so the graph on the left is the number of heat stress emergency department visits from 2010 to 2022. And then the map on the right has it broken down by the DOH health region, with red being a higher age-adjusted rate and the light color here being the lowest age-adjusted rate. So we can see emergency department visits due to heat stress about doubled between 2010 and 2022, with the Southeast and the Southwest regions experiencing the highest rate of heat stress visits. And then if we look at hospitalizations, we see an increase of about 65% in that same time frame, with the Southeast region having the highest rate, and then the Northwest region having the second highest rate. And then if we look at deaths, which is obviously the most extreme outcome, we see that deaths due to heat stress quadrupled in that time frame, with now the Northwest region having the highest rate, and this followed by the Southwest region. So now, again, on the portal, you can look at it by county, because obviously not every county experiences heat the same way. So looking at Bernalillo County in this time frame, we have emergency department visits on the left, and then heat stress hospitalizations on the top right, and then deaths on the bottom right. So for Bernalillo County, we can see that heat stress emergency department visits increased about 62% in that time frame. And then hospitalizations increased about 4.5 times, and deaths increased about 4 times, or about quadrupled. So it is always important to understand the data and think about the limitations and who we could be missing. So for the emergency department and hospitalization data that I just showed, that is what is currently publicly available on the portal. Those are both annual files that we receive pretty well after the year has ended. So for example, we just got in September the 2023 hospitalization data, and we're still waiting for the 2023 emergency department data. So there is a pretty significant delay, and we get it once a year. What we show on the portal only includes the New Mexico residents. We only get data from non-federal facilities. So we do not get data from Indian Health Services or Veteran Affairs. And we also do not get information on New Mexico residents who seek care out of state. So I went through this is basically 911 data. This is emergency medical services, the electronic patient care reporting, I think is the EPCR, for Bernalillo County for this summer. So we can kind of look at the 911 data to see who we are missing, knowing that we don't get IHS data, knowing we don't get out-of-state data, knowing we don't get VA data. So for Albuquerque, we're not actually missing that many people. When I looked at it for this summer, there were about, does it actually show my notes over here? That would be helpful. Okay, it does show my notes. That is helpful. So there are 258 calls that were transferred to an emergency department because obviously not every 911 call ends up going to the ER. So 258 heat-related calls were transferred to an ER. Of those, 6 went to a VA facility. So then we're missing about 2% of the data for Albuquerque. And then there were about 9 of the people here were from out of state. So again, a pretty small percent. When we look at, just for context, when we look at like Doñana County, you know, there's a good amount that get transferred to El Paso, especially in like the Sunland Park area, south of Las Cruces, and they go to El Paso and we don't get that data. So we do undercount for like Doñana County. And then when we look at like McKinley County, we see like in the Gallup area, a lot of the 911 calls go to Gallup Indian Medical rather than the non-federal facility. So in those instances, we are actually missing data. Fortunately for Albuquerque, it appears as though we have a pretty accurate picture of what is happening. So now for the limitation of this being an annual file, obviously, you know, it's nice to get it whenever we can, but getting the information now for last summer, like 2023, is not the most helpful for making any kind of decisions. So last summer, 2023, was the first time we really made use of the syndromic surveillance platform, which is a national program that basically emergency departments can, it's their choice, they don't have to, but they can participate and send in near real-time emergency department visits. It does have a different definition. So it is heat related versus strictly heat stress, because syndromic was developed to be used closer to real time before there is a definitive discharge diagnosis. So we include more people who might not have the discharge diagnosis of heat related. So it is not directly comparable to the emergency department visits we get in the annual file that we have in the queries, but we get this close to real time. And we've done a lot of validation work that it's good enough that we are comfortable using it. I will leave it at that. So this looks at 2019 to 2024, and you can see 2023 is the one that has this really sharp high peak in July. And what I found interesting with 2024 is that we didn't have the same really sharp peak, but it was much wider. So here, 2024 in May was the highest count of any of the years. And then in June, in July, we actually dipped down and pretty significantly lower than like 2023 July. But then in August, we were higher than 23 in September. So this is statewide. And then this is Bernalillo County, which is all the hospitals in Albuquerque, basically. So we can see it follows a very similar trend as the statewide, with 2023 having this really sharp high peak in July. And then 24, we see the peak in June, with the other months pretty much being higher than previous years. So then if we look at the total for the near real-time emergency visits that are heat related, the total statewide is the one in purple on top, and then Albuquerque is in orange below. And for us, we use April 1st to September 30th as kind of the summer. So statewide, we saw 957 heat-related emergency department visits this past summer, and 328 of those were in Albuquerque hospitals. And then just between 2019 and 2024, the heat-related visits about doubled, both statewide and in the city. Okay, now looking at mortality data, it's the same limitation where it's an annual file. So we get an annual file from Vital Records. I'm going to say almost always, it's always been in my experience. I'm sure there's been an exception. Usually with a much longer delay even than like the ED and hospitalization data. So we might get this annual file for 2023 in December this year or in January. And again, with the portal, what we show are New Mexico residents. One benefit of the mortality data is we do include, what we get from Vital Records includes all deaths in the state for all New Mexico residents. So whether they are a New Mexico resident or whether they died in the state, that is all included in Vital Records. So it is the most complete data source we get, although it's obviously the most extreme outcome. So again, with thinking of the annual file and the big delay in reporting, and especially this past summer, there were a lot of requests for heat-related deaths specifically. So we have worked with the Office of the Medical Investigator, or OMI, where we get reports every 2 weeks. It does come with a 90-day delay. So October 1st, we got the report for July. It does not include all heat-related deaths because not all heat-related deaths go through OMI, and we get very minimal information. But when we look at previous years, it seems like a lot of the heat-related deaths do go through OMI, so we can at least have an idea and closer to real time of deaths. So between April 1st and July 1st, which is the data we have available from OMI currently, there have been 63 deaths due to heat this summer. Almost all of them are in Doña Ana and especially then Hidalgo and Luna, like all the border counties. One was in Bernalillo. One thing too to note with OMI, we do not have any information about residency. So we can't say if these are residents or more likely migrants. We have looked at that in Vital Record data, and we can have, with Vital Record, we get enough data to kind of piece together where I am at least comfortable saying that, you know, these deaths are most likely migrants. But with OMI, we don't have that level of detail. We get very minimal information. So we can say that between April 1st and July 1st, there were 63 deaths that were reported and investigated by OMI. The total will obviously be higher. Now for things we were working on this summer. It was a very communications heavy summer. So we had 11 social media posts between Facebook and Instagram. This is an example of an Instagram graphic that went out. We also shared our social media graphics with the National Weather Service so that they could use our pictures and graphics in their messaging. We're also going to post these on the NM tracking portal so that anybody can download and use them. We've issued 3 press releases about, oh, and this is all heat related, not any of the other stuff we've been doing. So 3 press releases, our program or data or otherwise were mentioned in 28 news articles. We've given 14 presentations this summer. We've responded to 12 data or media requests. This included Senator Lujan's office, Representative Ferrari's office from Doñana County, New York Times, AP News, other more general questions and requests. The timer is so annoying. And then we have the tracking portal, and one thing that we submit to CDC is our web stats. So we track and monitor in Google Analytics, like the traffic to the page. So we've had over 2,000 NM tracking views in the summer, and we released, I actually forgot to mention, I'm sorry. We have a new dashboard this summer. I can't believe that slide didn't make it in here. I'm sorry. We have a new heat-related dashboard where all of this like near real-time data is publicly available, and the OMI data is up there, and I missed that whole part. Sorry. I'm really burying the lead here. There is that. I can get the link for that. There's also the cold-related illness dashboard that's ready to go. But this is all the communications work we've done this summer. It's about a 40% increase in traffic to our site compared to last summer, which seemed impressive. And then just to wrap up, so plans for next summer, we had hosted a heat planning workshop at Partners in Preparedness that Denise was gracious enough to present at as well. And with part of that, we offered a survey where, you know, we said, basically trying to find out like what would be helpful for people and what resources would be helpful to have if we can. So really look through all of that and see what we can accommodate. And then MNERD, the Energy, Mineral, Natural Resources Department, has a climate adaptation and resiliency plan that they recently launched. And then this past summer, they had climate community conversations, which there are several findings that were implicating public health and helpful for us. So look through those. We also have 2 current interns working with the tracking program. One is looking at heat among the American Indian and Alaska Native population. When we look at the maps statewide, and we can see the Northwest region progressively getting more severe with American Indians experiencing the highest rate of heat-related deaths, we wanted to look more into the Native American characterizing heat among Native Americans. So we have an intern working on that. And then we also have an intern working on really trying to figure out housing status and homelessness, because right now we don't really look at it or use it in any kind of meaningful way. So I'm excited he's working on that. Kanisha's working on heat in Native Americans. And then once we have those findings, we can incorporate the findings. We've also applied for BRIC, which is the Building Resilient Infrastructure and Communities funding. And then included in the FY26 Department of Health budget request, there are 6 FTEs for a climate program, which would be amazing. We could do so much with that. And then otherwise, more concretely, we do have some money in tracking that we are setting aside to conduct a PSA campaign next summer. We have some money set aside to have direct access to OMI, which would mean we can actually just access their docket and not wait the 90 days for a very minimal report. The next iteration of the dashboard, hopefully we can have it at the county level rather than regional, with a map, integrating the OMI data more into the data visualization. Right now, you scroll down to the bottom and it's kind of a table. And then also translating heat-related and other content on the portal. And I think that is all. So It's really, I'm gonna stop sharing so I can actually see everyone. Oh, geez, if I can. There we go. Okay. So that was a lot of information. I went pretty fast.
That was great information. Thank you so much, Chelsea, for being able to be our presenter today and being able to share all that information. I know right away when I start looking at this information, it just brings up so much that extreme heat is such a multifaceted topic, right? And it touches so much of what we're doing here. Shelley, I do see some of your comments in the chat. As far as updates, I do not have any as of yet. That might come later after the legislative session. So everyone stay tuned for that, but I don't have an update for that. So some of the questions that are in the chat that Shelley has for you, Chelsea, is who oversees the DOH syndromatic surveillance system?
Yeah, so that's in the Community Health Systems Epidemiology Bureau. There are a couple of EPIs in there who work really closely with the facilities and who manage the syndromic program.
It's in the community. Sorry, the names are all new, right, Chelsea? And
yeah, it's the Community Health Systems Epidemiology Bureau.
okay. And who's the lead on that?
So Christopher Whiteside is the bureau chief.
Okay.
And then there are a couple of EPIs who are the kind of liaisons and facilitators with the facilities.
Great. And it's an incredible resource that we have. It's like our best real time. I mean, I just want to commend you for using our best real-time, data, even though it has all those limitations, which are really important for us to remember, especially, I think, related to our Indigenous Native American folks who get their care from IHS. But it's still, especially for trends, it's great data. And I appreciate your saying that in Bernalillo County, the reliance is much less in terms of IHS and VA. So it's most, robust.
Yeah, another thing with Bernalillo County specifically, so all of the hospitals in Albuquerque participate, which is awesome. That is not the same everywhere. And they are also all very prompt with their reporting. So I believe I forgot to mention the dashboard. If you look at the dashboard for statewide and for other regions, you kind of have to wait a little while to really assess what's going on. But Bernalillo County, like metro area, within a day or two, it's pretty complete, which is amazing. Good job, you.
Great.
And then just quickly for Shelley, for Brick, I would have to go back and look at the actual application. It included an EPI and like one FTE, and then some subcontracts with community organizations, I think. Oh, interesting. So do you mean to go to an IHS facility has strict residency requirements, Anna?
Yeah, sorry, I was just trying to close the chat there. Yeah, I mean, you can be an enrolled tribal member, but depending on where you live, you may or may not be able to get service through IHS.
Yeah, IHS definitely plays more into the Northwest region for our missing data.
Sophie, I actually have a question on that. Is there, and this, you might not have this at the time of working on it, maybe after your intern finishes all the research into that. Do you have any thoughts on why the Northwest region and American Indians are experiencing such a high level of heat-related deaths?
So at first I did wonder, like, if it was like if we just saw higher deaths because they weren't accessing care in time and just going when it was more extreme and too late. But from looking at the EMS data, it looks like we're actually just missing the ER data. And so if we had that, it would likely be a higher rate for ER, in which case it's probably all just higher. I am not sure at this point. I don't really want to speculate too much because I am not sure. But I am very excited to see what Kanisha finds. And we're also
Great.
looking at like comorbidities and other like diagnostic codes for some of the other like risk factors.
Also had a question about the amount of deaths in Doña County regarding extreme heat. That was actually pretty alarming. So I'm wondering if you get more as you get more data in, if that's number's gonna increase significantly for Doña County.
Yeah, and I mean, again, we get such limited data that I can't say for sure, but looking at the ages and where they died, I would guess almost all of them are migrant. Which then if we look at previous years, like 2023 total, that's not what we have on tracking. But like the actual total not accounting for residency, it's in line with that so far, which is heartbreaking. But yeah, I expect it will just be higher as the
Yeah,
as we
please
get
share that
like
with me as it comes in. Based on this conversation when Chelsea presented on, we've heard, does anybody have any thoughts on where they would like to see this extreme heat work go? What I know for myself, personal goal is to see this cohort grow into something bigger, something that can actually implement change, possibly have access to funding that we can share and then subgrant out. That's just my own personal wish list that I'm hoping to work towards. Does anyone want to share anything regarding their thoughts of extreme heat, where they'd like to see it go in the future?
Denise, could you repeat that? It's for some reason for me, the sound is breaking up. I'm not sure why.
Sure. So I was just saying that for my own personal goals, I would like to see the cohort grow into something that can do more than just have meetings, which in themselves are great. It's wonderful to be able to have speakers like Chelsea and others that we've had and provide information, but I wanted to take it one step further than that. And the question is, how do we do that? How do we get to formalize it into something that could possibly, I don't know, at what point have funding or something that we could do more to help have projects or to really start implementing change when it comes to speaking. And I just wanted to get any feedback from the group on next steps or maybe some goals that they would like for themselves or the group towards extreme communication. Go ahead.
so I guess a question. Would you still want this to be Albuquerque? Because I know it started when you were with City of Albuquerque and it was the Urban Heat Cohort and like Albuquerque focused. Are you thinking of continuing it as Albuquerque focused or expanding the reach? Because I think my answer differs.
A great question. And I've been toying around with this and speaking to some connections and wanting to expand it to hopefully be something more like a Western resiliency cohort. So we can include more locations that are struggling with extreme heat coming together, really being that think tank and hopefully, again, wish list, something that I'm looking towards, nothing formal yet, to have maybe a look at a fund and then not just heat mitigation, but really everything that is resilience, right? Because we know that extreme heat can be tied to increased rates of flooding, increased risk of fire. So really looking at it through a holistic view.
Yeah. Because I think a lot of other cities and communities around the state could definitely learn from this group and learn, yeah, obviously Albuquerque has more resources than any other city. But sharing the resources and sharing the knowledge. We also have the climate and health adaptation work group. But I could see this being a separate thing, like, or we could join forces if you're interested, and just rethink the whole thing.
Yeah, that'd be really interesting. I'm happy to have those conversations if you want to connect me.
Okay.
Any other thoughts? Oh, hi,
Yeah,
Brian.
no, hey, no, I think you touched on something that I've been kind of thinking about too, which is I think it makes sense to kind of combine it into more of a broader resiliency kind of focus. I think it could bring in a wider group of people and communities. And yeah, I mean, based on just that data, you know, I know we've been kind of focused on urban heat, but clearly, the rest of the state is experiencing just as much of an issue. So yeah, so I like your thought on that and would throw my support behind that for sure.
Thanks, Brian. And
Mm-hmm.
Brian and I have also had conversations in the past about wanting to see more true resiliency hubs within our community.
Mhm.
So
Yeah.
we've always been kind of looking towards that.
Cool.
Go ahead,
And yeah,
Shelley.
Oh, are you done, Brian?
I was just going to say thank you for facilitating. So I've appreciated the group. So
Yes. So I think, Denise, I'm really grateful for your asking the question about what is this group's purpose and focus and how can we really make it a meaningful experience. I have to say I've really valued the presentations that you have brought in. Chelsea, I appreciate the update from you, and I keep thinking about what Braden K, which was a very powerful presentation. And we do need state agencies and other and local governments and tribes to really deeply engage in adaptation and resiliency. And I personally, I would be interested in exploring how the CHOG and this group might be combined. I participate in both. And I just, adaptation resiliency is incredibly important. I think you all know that Healthy Climate New Mexico is deeply concerned about these issues. We are sponsoring another heat summit on April 23rd, 2025. I mean, we can do things as an independent, nonprofit that are different than what state agency folks, but we need these collaborations between governmental agencies and people in the field who are doing this work. And I'm struck that the CARP, that Climate Adaptation Resiliency Plan that MNERT has put forth, we haven't seen the final version, but they don't have much resources either, right? From my perspective, I can't wait till that climate and health program's established. I am in prayer and hope that the governor, shouldn't even add prayer, that's really not, but that the Department of Health is ready for that. There'll be a legislative proposal for the program, and then our communities need funding. And I'm aware of a lot of resources. For example, there's a tribal resiliency grant right now that's due October 18th, but so far nobody in New Mexico has applied, and I don't know whether it's going to happen. So I think there's a place for building our capacity, a place for sharing resources, and especially a place for that collaboration between the governor's office, the agencies, the variety of agencies. So I'm interested, and community organizations and nonprofits like ours. I'm interested in that focus.
Lauren, I see your hand up.
Yes, it is. First of all, I just want to thank you for this wonderful effort, and Chelsea too, for all the work you've both put into this. This is really phenomenal. And Chelsea and Denise, you should have received a doodle poll from me. If you didn't get it, let me know. And then I just want to let people know that the Environment Department is working on moving forward with the heat standard. We hope to put it on the EIB agenda for May.
Thank you for that, Lauren. I believe I did, so I'll go ahead and fill that out. But yeah, it would be really great to have these continued conversations to see about possible merging efforts or just coming together to make one large group. So Chelsea and I will probably continue those conversations as well as our conversation. Provide any updates to the group.
I'm sending you an email now so we don't forget.
Wonderful. Yes, please do, because if it's not on my calendar and Any other comments, questions before we start wrapping up? We still have a little bit over 10 minutes. I'm not seeing any hands up or any further comments in the chat. So I think based on that, I might give everybody back a couple more minutes to their days. I'm sure we all have to get back to. But again, thank you, Chelsea. This was a wonderful presentation. Thank you all to being part of the New Mexico Urban Heat Cohort. We look forward to next session and look out for any emails of steps moving forward.
Thanks,
Thank
everybody.
you.
Thank you.